The Blood Journal studio has been buzzing with exciting news this week from several ASH publications. From journal launches and tips for authors to collaborative interviews between editors of ASH News publications and peer-reviewed journals, the Blood Journal studio is your place to interact with ASH's editorial leaders. I'm joined now by Editor-in-Chief of ASH Clinical News, Dr. Aaron Gerds. Dr. Gerds, how have you been covering the annual meeting this year?
So we have a lot of coverage of the ASH annual meeting this year for 2024. We're super excited to bring the latest and greatest in hematology to your front door. We're covering here on-site coverage with our emails, our print that will be out in the January issue, as well as a collection of videos that you'll be able to view online once they're produced. ASH Clinical News has a clinical focus, both taking translational science, but condensing it down for the clinician. We also have an outward focus, right? We want to reach everyone outside of ASH membership. We want to reach people in industry, advanced practitioners, those oncologists, or even practicing general internists out there who may be taking care of patients with blood disorders. Our magazine is written by staff writers, people who are scientific writers who aren't necessarily hematologists. And I think that helps us translate the science of hematology so everyone can understand it. We want it readable, for anybody who might pick up the pages of ASH Clinical News.
This also marks the 10-year anniversary of ASH Clinical News. What are you doing to celebrate?
Well, in addition to lots of cake, we're super excited to bring some reflective information to you. So in the December issue of ASH Clinical News, we have a reflection on how things have changed since 2014, both at ASH, in the world of hematology, and just pop culture in general. The piece I really like is a reflection from the past editors-in-chief, where they look back of how the magazine was brought together, how's it impacted them, and the world of hematology in general.
ASH News TV also spoke to the editor-in-chief of the Hematologist.
We were very fortunate that we have almost 20 plus years of history with hematologists. So what we have been doing is going back to the issues from the year 20 years ago and looking at what were then considered to be the cutting edge. Then we also introduced something called not so benign. We realized that there can be catastrophic, life-threatening consequences even for those classical hematological disorders. And this particular set of articles is focused on bringing to the forefront, what are the dangerous aspects of some of those classical hematological conditions.